Alright guys, I am here for the morning of surgery. I'm getting ready to go under and get my work done, get my V-lines done. I'm so excited and I am ready to show y'all the results. Stay tuned.
What we're doing, I'm marking the angle of the mandible, and also a lot of times when patients have this flare, the bone wings out, so I'm marking the edge of that, but then maybe even more importantly, where the bulk of the masseter is, where the muscle sticks out the most. So I'm going to try to take down some of that as well. The bony part is the important part, but the thing is it's important to mark right now with the patient sitting up, because when she lays back, it's gonna sit a little differently. So I know this patient really well. She did a full facial feminization about a year ago. Type 3 brow bossing, rhinoplasty. We did Renuva, which is a synthetic fat in the cheeks because she's very lean. At the time, we had a lot of discussion about her jaw. We really liked the definition that she had in the jaw. And so we decided to leave that alone and just do the chin to round it and make it less square. Now, it's been a year after all of this has settled. Still like the definition, we want to keep the definition, but I think now with the slightly more rounded chin, I agree with her, the jaw is now just a little too much. So the goal today is to take down some of the flare, some of the squareness that we see from her front view, but try to maintain the definition that we see from the side. And so the way that I'm going to make the cuts is what is going to do that. Here's the patient's CT scan, which we got from her previous surgery. Helpful now. You can see that she's got these, really how the mandible comes in and then flares back out here. The goal is actually just take off this flared part right there. So try to leave her with the same height and the same definition, but this part here, wings out, I'm gonna take that off. And you can see on the other side, you can see this view. So the mandible comes in and then in her, it really flares out again like that. I'm gonna cut that part off right there and then probably burn down a little bit of this thick part.